I'm Dr. Gitika Sud. I'm working as a visiting consultant with Medanta at the Medicity. I specialize in geriatrics. The most common respiratory diseases which we come across people, especially in the elders in the winters, is exacerbation of COPD, which is chronic obstructive pulmonary disease, flare-up of asthmas, allergic bronchitis. So a lot of people are allergic to the air pollution. This is particularly bad for patients whose airways are already compromised, or in short, people who are suffering from COPD. Their lungs are anyways not working at optimal capacity, and to deal with air pollution then triggers exacerbations of their clinical condition, and pneumonias, infections are a very common problem for them. Once again, some people are more susceptible to changes in cold, and extreme cold can then act as a trigger for flare-ups of their lung conditions. So symptomatically they then present with increase in coughing and a chest infection. So people with, people who suffer from COPD, for them, making deep breathing exercises a part of your daily routine is very, very important. It improves your lung capacity in more ways than one. Try to keep away from pollution. Take the medication as advised by doctor, because sometimes one simple tablet is all it needs for your flare-ups to be controlled. Staying indoors, especially on days when the air pollution is high. Keeping plants in the room is a very good way of dealing with air pollution. Having purifiers in rooms, especially for people who do suffer from COPD, is a good solution. Once again, looking after your general health, which we tend to ignore because of shortage of time. Just as one takes out the time for your work-related assignments, I think it is imperative that we take out the time to look after our health. Exercising every day, and when I say exercising, it could be something as simple as a walk. So walking for about 40 to 45 minutes every day. This is over and above the activity you would do during the course of the day when you're doing your household chores, or you're doing your office related work. This is a focused activity which we're doing only to look after our health. Secondly, making pranayama and deep breathing exercises a part of our daily routine. We can really optimize the health of our lungs. Keeping plants indoors, keeping out of staying indoors when the pollution is high outdoors. People who are more allergic to dust mites can avoid going to dusty environment. So these are the general, staying out of extreme cold. These are the basic steps we can take in looking after our health. Seniors are more susceptible to flare-ups of their respiratory diseases during the winter season. So looking after your health by and large would be a great idea. So do ensure that you're have warm water, do gargles and steam inhalation, make it a part of your daily routine. Breathing exercises for about 15 minutes in the morning and 15 minutes in the evening. Avoid outdoors if the pollution levels are high. Maybe you could practice a bit of yoga and pranayama indoors in an area which is well lit. Keep plants indoors. The kind of plants which you can use indoors, which specifically are very good in dealing with air pollution, are the snake plant, aloe vera, money plant. So just having a few plants in every room of the house will really improve the air quality index within the house. Look after, do take your medication on time. stay away from people who've got simple viral infections, because others can deal with those viral infections easily. But in case of senior citizens, they will, especially with a background of respiratory illness, they can cause a flare up and hospitalization at the minimalistic provocation. So keep away, maintain good hand hygiene,